Hey everyone, in today's video we are going to talk about two disorders that are often mistaken for one another. It is bipolar disorder, BD, and borderline personality disorder, BPD. Both affect mood and behavior, but they both have distinct features and causes. So let's break it down and what makes them different and how they overlap. Bipolar disorder is a mood disorder that causes extreme mood swings, including emotional highs, known as mania or hypomania, and deep lows, known as depression. When someone is in a manic state, they might feel super energized, they talk fast, they take on risky behaviors, they have racing thoughts. On the flip side, however, when they are in a depressive state, they might feel hopeless, lethargic, or lose interest in things they once enjoyed, like say art or writing or like exercising, like riding a bike or something. Whatever hobby or whatever they love to do. They lost interest. Those mood episodes can last for days, weeks, or even longer, and they can be separated by periods of normal mood where the person feels stable. However, for borderline personality disorder, or BPD, is a personality disorder that affects how the person views themselves and others, often leading to intense emotional reactions, instability in relationships, and fear of abandonment. People with BPD often experience extreme emotions, like feeling really happy in one moment and then increasingly sad or angry the next. Like myself, I struggle with that all the time, and I still do. People with BPD struggle with self-image, and their self-image can shift dramatically. They might struggle with impulsive behavior such as risky spending so heavily for me, substance use, or even self-harm. A hallmark of BPD is overwhelming fear of abandonment or being abandoned, which can lead to frantic efforts to avoid being perceived rejection, or even if it's not real. The difference is mood swings versus emotional instability. The big difference is the cause and nature of mood swings. In bipolar disorder, the mood changes are typically more extreme and last for extended periods of time, like days or weeks. In BPD, the emotional shifts can happen quickly, sometimes pretty quickly, sometimes within hours or minutes, and are often triggered by emotional events like say a car wreck happened and I get like super angry kind of thing. Obviously I would be angry, but then I would be suddenly super sad. That would be a BPD moment. Especially interpersonal ones. Bipolar disorder is generally believed to have a strong biological basis, with genetics and brain chemistry playing with significant roles. BPD, on the other hand, is often linked to early trauma and difficult relationships through genetics, can also play a part. Mood I cannot speak today. Mood instability, both bipolar disorder and borderline personality disorder involve mood instability, but the way the mood shifts happen and how long they last are different. The risk of self-destructive behaviors for both disorders, they can be self-destructive and they can cause impulsive decisions, risky actions, or self-harm. However, the triggers and reasons behind these behaviors differ. Bipolar treatment for bipolar, that often includes medication like mood stabilizers or antipsychotics to manage mood swings. Therapy can help too, but medication plays a crucial role in maintaining stability. Myself, I am on medication and therapy, and they both help for managing borderline personality disorder and bipolar, and along with many others, but that will be in another video one day. Borderline personality disorder for treatment. Therapy is the main treatment. Dialectical behavior therapy, DBT. Makes me think it's a D. Is the most effective treatments helping people with BPD. Words are just so hard right now. Managing emotions, improving relationships, and reduce harmful behaviors. Medications might be used to treat symptoms like depression or anxiety, but they aren't the primary treatment. So with bipolar and borderline personality disorder involve intense mood swings. They differ in their causes, the duration of the mood changes, and the way they impact daily life. If you or someone you know is struggling with either of these, it is really important to reach out to a healthcare provider for support and guidance. If you found this video helpful, please give it a like and subscribe for more mental health content. I also do some gaming content as well. Feel free to check it out. Let me know in the comments if you have any questions or if there's something you'd like me to dive deeper into. And I will see you all in the next video. Bye bye.